We're going to talk about just the physical characteristics of the ultrasound first, and then we'll go in depth on the screen. So, all right, to start, on the right-hand side of the system is the power button, which lives right here. I'll add a red sticker to make it a little bit more obvious. From shut down, it takes only 30 seconds to turn on from boot up, and then for standby, it's only 6 seconds, and that's what that screen looks like. The battery life is 2 hours. I do recommend plugging it in when it's not in use, and at the end of the day, turn it off, plug it in, okay? And then I do not recommend leaving this on standby for hours. It will kill the battery, all right? There is a brake on each wheel, so you just push on the bottom lever, push down. To undo, push the top lever. And on the back side, underneath this bracket is a retractable cord, kind of like the old vacuum cleaners. There's a designated spot for wipes, designated spot for gel, and then your basket you can put your supplies in. And now we're going to zoom in onto the screen here and talk about workflow and all the different functions. So if you look over here on the right-hand side is your workflow. We're going to start at the top. That's step 1, patient. You will manually enter the patient information. You want to enter name and date of birth, possibly medical record number, okay? So all you do is put your finger in the field, type the name, move on to first name, type, and then date of birth, you just scroll. When you're all finished, click on the bottom right-hand corner to done. Now you're ready to scan. Your next step, step 2, you're just going to move down the row here to probe. You have 2 transducers on the ultrasound, and I'm just going to go over basic ultrasound tips. So this is your curved probe. You see there's a curved shape to the transducer, and on the transducer you see a C. Think about core, so liver, kidneys, gallbladder, anything deep in the abdomen. This is your transducer. Now this is your linear probe. See the capital L? Think about limbs, arms, legs, neck, any lump or bump, everything superficial. And you'll see some buttons on this transducer. We'll go over this at a later time. So now on this probe page are all your presets. I'm going to add some more on here. This is not the final preset, but under curved, you have abdomen, bladder, I'm gonna add renal, and I'm gonna add pelvic. Linear, I have thyroid, breast, soft tissue, vascular, so think about your DVT studies, or arterial. I'm gonna add IV access. I forget, I'm supposed to add another one on here. But the idea is you touch the name of the preset, so that preset changes.
So what kind of settings are changing for the
Yeah, that's a great question. So what is changing? The depth could be changing, the gain, so the overall brightness, and another thing called dynamic range. Dynamic range is important in different settings. So like your abdomen settings, thyroid, you want a higher dynamic range so you can see those subtle masses, okay? For something with like needle access, the dynamic range is going to be lower, so they're more contrast, more black and white, so you can see the needle. That's something you don't need to worry about. That's what I take care of when I make those presets, okay? It's a great question. Save image is on the middle of the bottom of the screen. You just click. Save clip. You can do a video clip, or another term is cine. It is set up for 10 seconds in duration. However, you can stop it at any time. So if you got whatever you needed, just click the button again. This print button, ignore. This is assigned for a Sony printer. We did not purchase this, but if you guys need it at a later time, just let us know. And then freeze. You can freeze the screen, and then go back in time to select a single frame. Couple scenarios this is important in. Let's say you have a patient that's very uncooperative. They're kicking, screaming, you're trying to do an exam, and you don't want to take a blurry picture. Your loophole with that is hitting freeze and then finding that frame. It's kind of like the iPhone features. You guys have an iPhone? The live mode, just like that. Another scenario is if you're doing some kind of needle procedure, let's say a thyroid biopsy. You really want to show that you were right in the lesion. You hit freeze and go back in time, because sometimes your docs might just put the transducer down and you didn't get your image. Hit freeze really quick. Okay? Once you find your frame, you click Save Image, and that is saved. On this right-hand side, you see gain and depth. Gain is overall brightness. This makes the screen brighter when you go up, and it makes it darker when you go down. I do suggest just tapping above or below that circle so you have control of your movements. And depth just allows you so you're not cutting off an image. So if you need to penetrate further, you tap below the knob. And if you want to zoom into your area of interest, you tap above. And then you can reference this ruler right here. It's in centimeters to see how deep you are. On this right-hand side, on the bottom of the page, is your imaging modes. Couple of the most common modes would be color. So if the doc wants to see color on a vessel, etc., you turn on color. You can change the size of the box by pulling any corner. And then to move the box, you put your finger in the middle of the box to move it. So one common request a doctor will ask is, can you put color on? And then move the box over the vessel, etc. Another thing, do you guys use Doppler or pulse wave when you do ultrasounds? Yes? Okay. I'm going to demonstrate that. I'm going to just scan myself really quick. I'm going to scan my aorta to give you guys a visual. So I'm going to turn off the color. So to turn off color, just touch color or touch the B button. B just means B mode, meaning the grays, blacks, and whites. Okay. So here is my liver and my IVC. I'm going to demonstrate depth here in a minute. So I have a lot of information below that I don't need. So I'm going to zoom in so I can focus on the liver and focus on that IVC. You don't want too much depth like that, because then your doctor can't see what they're evaluating. So remember, do the taps. All right, now I'm going to demonstrate color. So blood flow is going to light up on the ultrasound. You see the reds and blues? Now I'm going to touch PW. PW stands for pulse wave. Another term some doctors might say is Doppler. Click on PW. You'll see a green line come up, and you're going to see two horizontal lines right there. You put that over the blood vessel, and then click PW again to activate. So that's the sound of my IVC. Now I'm going to do arterial so you can hear the heartbeat sound there. Activate. And you can freeze. If you want to remove all of these functions, just hit B again. Brings you back to the grayscale image.
So you could do that for any peripheral, so Doppel, pedal pulses.
Exactly.
Okay.
Pedal. Let's say if you want to do an OB really quick, you can. M mode is common for babies, or pulse wave.
So we just have this. We're just gonna have the two probes, the linear and the curved.
Sounds like you might want cardiac, so we can talk about a later date if you guys want to purchase a phase array. You can use the curved if you want to quickly look at a pericardial effusion. It'd only be sub-xiphoid because this transducer is large. So you just go into the xiphoid and image there. So you can do transverse view and look at fluid that way. Okay. Couple other things that you can do on the screen. You can measure and add labels. So if you look on the bottom half here, I have measure. And you see this little hand come up here with the crosshairs. The hand is like your mouse, computer mouse. You're going to use that to control the crosshairs. So move the T there, tap to set. It's pressure point, so make sure you're putting some pressure when you tap. And then drag and tap. And then tap to set. Your measurement is saved. Another feature is annotate. Right below measure, you click annotate. There's some factory labels you can add on your images, but you can also free text by clicking keyboard. And then you can type whatever label you want. And you can save your image there, so it's saving your measurement or your annotations. When you're all done with your exam, go into this review button here. You can review the images you took here. And then when you're all done, everyone must hit end, okay? After every patient. When you hit end, this will wirelessly send to you packs, okay? You have a wireless connection. However, if you're having Wi-Fi troubles, you have a wired connection too.
You have to put it into a direct port. Make sure everybody knows where.
Ports are on the back side here. So you can see we have USB, we have the Ethernet cord here, HDMI and VGA if you have that need.
So it automatically sends it to packs. We don't have to push it through.
Automatically when
So
you
we hit
click
end.
end.
Okay.
Mhm. Yes.
Does it just do that off of the account number, I guess, or the MR number?
So,
It's just a 7-digit MRN.
It's the
Mhm.
MR number.
yes. Any questions so far?
One thing, I mean, we have our bladder scanner back, but should that ever disappear again, would there be a way for us to get a bladder's volume from this?
Of course.
Could you demonstrate
I
that?
can demonstrate.
One of the main things we wanted for. Beautiful.
Yeah, I'm sure. Looks good.
I don't know if my bladder is that full anymore. Earlier, it was like
full a while
600
ago.
cc's. We'll see here. So I'm gonna unfreeze. I have a quick guide I can share with you guys. You can keep on the system, but it is dependent on the user. So knowing how to scan the bladder. So
Yeah.
there's two views: transverse, which is the horizontal way, and then vertical. You want your indicator, the dot, to always be on the right side. On the right side, or facing up towards the patient's head. Okay? So you're gonna place the transducer in the pelvis. Right now I don't see a bladder. What you have to do is a scooping motion down, kind of like an ice cream scoop, underneath the pelvis. Oh,
There he is.
Black on ultrasound is fluid filled, so this is
Yes.
obviously my bladder. So you want to scan through it, top to bottom. So right here I'm top. I'm
So
gonna,
she's tilting, she's not necessarily going up and
yep,
down.
so I'm going like this, scooping motion, kind of like you're getting ice cream, okay? Scoop all the way down, and you're gonna find the widest dimension. So let's say this is my widest dimension. I'm gonna freeze. So see how I moved here a little bit? I'm gonna go back in time to find that ideal image, okay? Now I'm gonna hit measure. I'm gonna go under advanced. So I have basic and then advanced. I wanna go to advanced and then find bladder. And you can see there's measurements for pre and post bladder. You're gonna see a letter, L meaning length, H meaning height, W meaning width. So you need 3 dimensions for a volume. Right now I'm gonna transverse view. I'm gonna get my width here. So touch my hand, go to the outer edge, tap to set, drag, tap to set. Now I'm gonna click on pre-bladder height, H, measure top to bottom, tap to set, and tap to set. I'm gonna save my image, unfreeze. Now I'm gonna move my transducer so it's vertical. Same scooping motion. I'm really like touching the pubic bone. You guys really have to be down there to see it. And then same idea, I'm gonna fan, kind of like a flashlight. I'm looking in a room, left to right. Find the widest dimension. All right, I assessed. I think this is my widest. I'm gonna freeze. Go back in time. There. Go back into measure. I can see it's saved my advance. I'm gonna go into L for length. Tap to set. Tap to set. It looks like I have 141 cc's in there.
Do you know what the factor, I didn't ask you that before.
Mhm.
Is it .52 is it using, and .7, or what, because they're all different, because the .52 is for oval and the .72 is more for a wedge shaped. So do you know what the factor that it uses? Because we've always used .52, otherwise that is gonna change according to what we've done in the past.
Yeah, let me look at the properties here.
Okay. .52 is. on the-
That sounds right.
Yeah.
It's 0.52, but I'll let you know.
Okay.
Okay?
So it's height times width times length times .52, just so
Yes.
everybody knows that mathematically.
Yes,
That's how you do it.
exactly. We can practice scanning the bladder if you want, but I'm gonna keep going because we're getting videotaped and then we can practice, okay? So, just to review, when we're done, you hit end, it wirelessly sends to PACS. A couple things to clean the system. Looks like you guys have purple top wipes here. I've been seeing them everywhere. Those are approved. You can clean the transducers. You can clean this one too. I know it has buttons, but it'll be okay. And then to clean the screen, if you touch the top right hand corner, there's 3 horizontal lines. That's our menu. Screen lock. You hit OK, and you have the chance to clean your screen. You know, wipes leave a residue, so you can follow up with the wet washcloth to remove that film. Okay? So there you go. Gives you 10 seconds. I think that's pretty much it. Any-
Storage on the probes is obvious, I know, but
Storage. So iStation. This is your patient repository, your storage. So all of your exams are going to live here. It'll auto delete after 500 exams. The oldest gets deleted. Okay, so you don't have to worry about that maintenance. If you ever need to reference an image, if you want to review, let's say my example earlier was, you know, Jane Doe has a cyst on her hand a week ago, and it was measuring 1 centimeter. And you want to review that study, you can go on PACS 1. 2, you can also look on here. You can find the patient, you double click to open it, and then you can reference those measurements to compare. If the cyst got
And this
bigger or
is
smaller.
Machine specific. So, right, okay.
correct,
Machine
it won't go
specific.
to the other one.
So then-
However,
This will
be
PACS,
in
you'll
PACS.
find it.
Yeah.
Yes.
What if you wanted to do a bladder scanner and you didn't want to necessarily send it anywhere? Can you just not save it?
If
Yeah.
you don't save the images, you can't bill for it, just so you know.
Okay.
If you just wanna get a measurement or whatever, that's fine, but I'm just saying,
Yeah.
just so you guys
We
know
don't get to
that.
bill for the fact that we did a bladder
Right,
scan.
okay.
Yeah. So if you can bill, I would really recommend
Okay.
putting in those
Have we
patient
charging for
demographics.
this?
Hmm?
Have we been charging for bladder scans?
Not as well as we used to without the printer.
Yeah.
'Cause
Yep.
I think that's how.
So I believe you can. It's
Yeah.
ladder limited,
Yeah,
I think is the code.
Do you know
might
the
be
answer to
ladder
that?
limited postal
We'll
work.
figure out how to
Mhm.
charge that.
Yes.